Hello everyone, I'm Dr. Francisco. Sorry for being a little bit late. I was seeing a patient. So today we are going to discuss why diet control is so important for kidney disease. Remember, this is a video blog destined to help patients with kidney disease or kidney-related conditions to understand the disease better so they can manage it better together with their own doctor or with me if they choose me, so they can minimize worries and complications. And this is sponsored by Francisco Clinical Medical Center, where I am the medical director and the nephrologist in charge. Yeah. So let's start. Why is diet control so important for kidney disease? A healthy diet and a more active lifestyle is crucial for everyone, having kidney disease or not. However, diet control, with many unfortunate unnecessary restrictions, is of pivotal importance for patients with moderate or advanced kidney dysfunction to maintain their health, minimize disease progression, and prevent medical complications. Of similar importance is following a healthy and active lifestyle and getting rid of any bad habit like smoking. I repeatedly say, but because it is very important and true, that patients living a more frugal life, controlling their diet, doing their best to follow the diet restrictions, remaining active physically and intellectually, and who have decided to come into better terms with their disease, tend to live better and longer lives than patients who have decided otherwise or who cannot sustain that. Now it is the time to talk about diet and to tell you why it's so important. Because now is also the time to start doing some modifications if you have not done it, or if you are finding some difficulties to try to get extra help. Through the food we eat, we nourish our bodies, but when it is in excess, unbalanced, and deficient diets, deficient many components, unbalanced towards certain components, our health can be compromised. Through our usual diets, we consume excess of many components and occasional toxins, and several organs in our body, like the liver and the kidney, help us eliminate that excess or detoxify our system. In patients with significant kidney disease, many of these processes are deranged, and the remaining kidney function is unable to perform to satisfaction those detoxifying and regulation or regulating roles. As a consequence, many of the substances derived from the diet that normally are kept in control, like potassium and phosphate, can go high in the blood and reach toxic or even dangerous levels. A reason to control food with high content on phosphate is to protect the bones, but also it can protect your cardiovascular system. Controlling, on the other hand, food high in potassium can be beneficial, as its excess can cause erratic rhythms of the heart or simply put it to stillness, which it is very scary, correct? Likewise, it is ideal to control the food with high content of sodium to avoid fluid retention, control better the blood pressure, and protect the heart and the cardiovascular system. And unfortunately, the vital fluid, I'm referring to water, needs to be controlled in patients with more advanced kidney disease or total kidney failure to avoid fluid retention, high blood pressure, or dramatic shifts of blood pressure, and to prevent acute or chronic heart failure. knowing both the consequences of not controlling the diet and the benefits of putting effort on diet is sufficient for many patients to adapt and embrace more graciously all the diet restrictions that we doctors recommend. We can imagine how difficult that can be, but unfortunately is necessary and crucial for a better health and a longer and fuller life despite having kidney disease. However, it is not just eat less of this or less of that, or to tell you eat less sodium or potassium or phosphate, because no one is eating sodium, potassium, or phosphate. We eat complex foods with a myriad of ingredients, many of them still very useful for health and a good nutrition. So we need to give you a more strategic diet advice, a balanced diet advice. Because the other side of the coin of these dietary restrictions is that they can facilitate or predispose you to malnutrition and certain nutritional deficiencies. In addition, kidney disease is considered a catabolic disease. That means it can make your body to consume faster resources or not to utilize them properly. And therefore, it is associated with malnutrition and those deficiencies. Yeah? Therefore, a balance must be aimed when advising patients about diet restrictions. And unfortunately, the truth is that that balance is not easy to achieve. But that does not mean that it's impossible. However, if the patients are advised to and they follow a more balanced, varied, and moderate diet, allowing things not to go too much overboard, that balance I'm referring to is easier to be achieved. Reason for which self-control and living a more moderate and active lifestyle is the clue. So this is the first video of a short series of videos on kidney and diet. We're going to also discuss a little bit about fluid over the next weeks, because as I commented, diet, it is very important. How many times you have heard that diet is the best medicine, or at least the best preventive medicines, because together with exercise, I think probably a positive mindset, proactive, receptive of change, empowering, together with a active lifestyle, a good diet, and acquiring as many good habits as you can and getting rid of any bad habits like smoking or excesses, then altogether are definitely the best preventive medicines. So if you like this advice, if it's useful, please put likes there, share with your peers or with friends or family that have kidney problems or risk of kidney problems, the existence of this group. And if you put a comment later, I will reply later. Otherwise, I'm Dr. Francisco, wishing you the best possible health.